Well, many teens are at the age where they become focused on body image. It's a situation that can actually lead to depression and even eating disorders. Joining us again this week is licensed professional counselor Kesha Simmons with the Family Connection Center. Today we're focused on what parents and adolescents need to know about how depression and eating disorders are linked. Kesha, good to see you.
Yeah, good to see you, Jeff.
Yeah, let's talk about these two conditions combined and how they affect teens. Depression and eating disorders seem to kind of go together.
Right, well, there's an intersection because obviously the symptoms manifest very similarly. Like number one, you mentioned body image, right? We have children who may overeat, right, or undereat, depending on what's going on with them. Teens will also use food for emotional regulation, right? We know emotional regulation is a symptom of depression, but it can also be a sign of an eating disorder, right? So kids will overeat or undereat to manage negative emotions or relieve themselves of negative emotions.
How much does peer pressure factor into this as well? I'm sure that plays a big part.
Well, absolutely. I mean, as teenagers, you know, we want to get along, be accepted, right? And so part of that's where the body image may come into play, right? And then social isolation, wanting to socialize. So that peer pressure, you know, not being accepted in certain social groups can cause some insecurities.
What signs should parents be looking out for to see if their child may have a possible eating disorder?
Right. Well, isolation is one. If you see an increase or a decrease in eating is two. Abrupt changes in certain types of food, you know, wanting to take on more junk food, or see them comfort eating, so to speak. You want to look for that as well.
What strategies can parents use to help their teens that may have eating disorder? Anything they can do specifically to help them?
Yes, communicate. Make sure you have open communication, and this is where I recommend ask, don't tell, don't project, you know, your own thoughts or feelings about it, but ask more questions. Just ask this child, engage your child, and ask what's happening. I notice a difference, what's happening with you. And then, of course, if it gets too extreme, you want to talk to your primary care provider or maybe even get in and see a therapist that specializes with teens.
Now, where can parents find resources for this to help?
Yeah, you can go on the National Eating Disorder Association.
Okay.
That's a website, an excellent resource I may add, just to explore some of what I've just mentioned, and they go even more in depth with providing support.
Yeah, you really have to watch them closely.
You really do, because those the symptoms can be you know, a lot of our disorders have some of the same symptoms, and so a professional will know how to dig deeper to determine the right diagnoses. Right, so it may not be an eating disorder, it could just be depression.
Yeah, could be. Thank you, Kesha.
Yeah.
Thanks so much. Always give us some great insight.
Thank you, Jeff.